Okay, now we'll discuss about acute cholecystitis. Okay, acute cholecystitis, it is like two types. First what types? Two types: calculus cholecystitis and acalculus. Okay, acalculus cholecystitis. In most of the cases, it is said that in 90% of cases it is due to the calculus cholecystitis. Okay, and now talking about the calculus cholecystitis, possible pathogenesis, and what happens is sorry. In calculus cholecystitis, when the stones get laws, when they obstruct the drainage of the gallbladder, and there is stasis. Okay, the stasis of the bile in the gallbladder, and due to stasis there will be like distension of the gallbladder, and due to which there will be like blood supply and lymphatic supply, blood and lymphatic drainage is obstructed, which causes like mucosal edema and like necrosis. Okay, mucosal edema and necrosis occurs, and also due to the stone, due to the pressure effect of the impacted pressure effect, due to the pressure effect of the stone, it causes the mucosal erosion. Okay, like the mucosal erosion will occur, and in this, after the mucosal erosion, like bile salt act on the submucosa, and it causes like necrosis. It's toxic, like bile salts are toxic to the submucosa, so it causes necrosis and the perforation necrosis, and by this process there will be two necrosis, so there can be perforation can occur. Okay, and during the stasis, during edema, and all these cases, like during the necrosis phase, and like organism can reach the gallbladder via three route. Okay, one can be from the blood vessels, like our portal vein can be there, or on the hematogenous route, like hepatic artery or cystic artery. From cystic artery it can go, or it can also reach to the bile. Okay, from the liver, bile via liver and all that. Okay, and the most organism are like our gram-negative organism, like Klebsiella can be there, and the Pseudomonas, Proteus, E. coli. Most important is E. coli. Okay, E. coli is commonest, and there can be like Klebsiella, Pseudomonas, Proteus can be there. Okay, and like other like Salmonella, Clostridium welchi can be also there. This organism. Infection, due to infection, there is edema, necrosis, there is inflammation of the gallbladder will be there. Okay, and now talking about our clinical features, and like there will be a sudden onset of like pain will be there. Okay, pain in the right hypochondrium will be there, and the pain will be there in right hypochondrium, and okay, pain will be there in the right hypochondrium, and also it can also radiate to the towards the ninth and 11th like reeve posteriorly on the right side. There will be area of hypoesthesia. Okay, in this area there will be the hypoesthesia. Okay, hypoesthesia is also called Boas sign. Okay, Boas sorry, BOAS Boas sign. Boas sign will be there. Okay, and then like is there pain in the right hypochondrium. It can also like I forgot here, radiate to the tip of the scapula, tip of the right scapula. Okay, and in that hypoesthesia will be Boas and positive, and like there can be tachycardia and toxic feature will be there. I forget one most important thing, like it's not in pain. Okay, toxin and fever can be there. Okay, fever can be there, tachycardia, toxic look will be there, pain will be there. These are the most important sign. And in case of like acute cholecystitis, we can also find like our Murphy sign will be positive. Okay, Murphy sign will be positive. It is like during the deep inspiration, there will be deep inspiration. There will be when we palpate the right hypochondrium during deep inspiration, there will be arrest of the respiration. At the height of respiration, there will be pain. So there will be arrest of respiration will be there. Like this should be distinguished between like Courvoisier sign, like Courvoisier or Courvoisier sign, where this is found in peripancreatic malignancy, and in this case there will be non-tender but palpable gallbladder. Okay, and now talking about investigation. Okay, since this calculus, so we'll go for like X-ray, but before X-ray other investigation are important investigation are remaining. Like we'll go for CBC, like CBC, then neutrophilia. Okay, neutrophilia will be there. Okay, and like CBC neutrophilia will be there. Now in imaging you can go for X-ray. 10% are radiopath stone, and so USG can be done, like ultrasonography can be done, and then other thing like radioisotope scanning, isotope study. Okay, so HIDA or PIPADA. Okay, this isotope study can be done, and then others like ESG, X-ray, and liver function test will be deranged. Okay, and then liver function can be seen, like in case of cholangitis or stone in CBD, and there will be increased bilirubin. Okay, and these are the investigation. Now talking about the treatment. Okay, in treatment we go for, first of all, hospitalization can be done, and first of all like medical management can be done by IV fluid by like nasogastric, that aspiration of the all fluid, nasogastric aspiration is done, IV fluid is given, analgesic is given, antibiotic is given. Okay, and then by this thing mostly that the acute condition will subside, and then we can go for interval cholecystectomy. Okay, acute cholecystectomy. But if this condition do not subside, or there is empyema, or there is progressive symptom, we should go emergency cholecystectomy or Schistostomy. Okay. Mostly in the if the acute condition is subside, then we go for interval cholecystomy because there is a chance of injury to the other structure while giving cholecystomy during the inflamed condition. Okay, and then these are the things for like our this for calculus cholecystitis. And now talking about the calculus. Okay, talking about calculus cholecystitis. Calculus cholecystitis, it is very few, only about 10%. 10% of cases there can be calculus cholecystitis. Is in the conditions like the symptoms will be similar. Okay, symptoms and treatment is also similar, but this is seen in case of like stasis, like major trauma, major surgery, bone patient, sepsis patient. Okay, this acute cholecystitis can occur. Okay, a calculus cholecystitis can occur, and like in most in case of ICU patient. Okay, and some also say that this is due to the like activation of factor 7. Okay, factor 7 and may cause like relative activation factor 7 may be the cause. Some say only this. I don't know much about this thing. The major trauma, surgery, bone shapes in this case, acute cholecystitis, and other things are similar to the like calculus cholecystitis. What can be the complication? Okay, complication can be like there can be peritonitis. Like first of all, perforation can be occur. Perforation of purpura can occur. Peritonitis can occur, and other thing like cholangitis can occur. Okay, there can be sepsis can occur. These are the things which can occur in case of like mostly these are the important complication of our acute cholecystitis. Other okay, this much for our cholecystitis.